Good afternoon and welcome to the Caregiver Teleconnection. My name is Glenda Rogers and I'm going to be the facilitator for today's session with Dr. Natalee Oliver. Welcome, Natalee. And she's going to be talking about dementia and the hidden patient, a very interesting topic. Before you get started on your presentation, Natalee, would you go ahead and tell people a little bit about yourself in case they haven't heard you before?
Sure. Thank you for having me here today. I'm a clinical social worker. I am a professor at the local community college here in Waco full-time. I also do adjunct at Tarleton Waco in the social work department. And I've been volunteering with the Alzheimer's Association in some form or fashion since I think about 2007 or 2008. So it's been a while. Support groups, education, fundraising, things like that. Okay, you ready for me to get started?
Yes, please go ahead.
Here we go. Thank y'all so much for coming today. First of all, I want to start off just with a lot of times you'll hear people use dementia and Alzheimer's interchangeably. I'm guilty of, but the thing I want to express to you is that Alzheimer's or dementia is this set of symptoms that affect memory, thinking, and behavior. And so you can think of this umbrella term. A lot of times the Alzheimer's Association will want you to visualize this set of symptoms. And then Alzheimer's is one form of dementia, and it's the most common type. The main thing I want to stress is that it is not a normal part of aging. And so a lot of people think it's normal, and it is not. Oh, and we'll have the resources available that I used for this PowerPoint if you want those as well at the end. There are certain risk factors, but the main thing to point out here is that researchers say there's not just one specific thing that causes Alzheimer's disease. We do know the greatest known risk factor is increasing age, especially when you reach age 65 or older. We also know family history. If you have parents or siblings, it can increase the risk. It doesn't guarantee you're going to get it. It just increases the risk. Head injuries as well. We also know that the risk of developing Alzheimer's or vascular dementia appears to be increased with many conditions that damage the heart and blood vessels. So you can see the list there. And then what researchers are looking at now is they're saying, okay, we need to all try to age healthy, which is that eat healthy, exercise, do not drink in excess, smoking, etc. So all of that, that's what researchers are looking at now to see, okay, that may affect the risk for Alzheimer's as well. If you've ever been to any of my presentations, I do like to put in numbers, and not that I am a great statistician, but because I love to show the impact. That's what I'm wanting you to see here. So currently we have over 6 million Americans age 65 and over that have Alzheimer's. We know that's going to practically double by 2050. So a lot of times I tell students or other colleagues or anyone that even if you say, I don't want to work with the older population or Alzheimer's, or this doesn't affect me, it can affect you indirectly. So that's why these kinds of trainings are so important. We know that once someone's diagnosed with Alzheimer's disease, not once they start showing symptoms, but once they are diagnosed and they're age 65 or over, their average life expectancy is to be 4 to 8 years, but we also know people live up to 20 years after that diagnosis. Things I wanted to focus on today as far as the caregivers. This is a startling fact that more than 11 million Americans provide unpaid care. Some of you on here may be those. Those are family, friends, neighbors, church members, community members, and such. And so in just last year, these unpaid caregivers provided more than 16 billion hours of unpaid care in the last year. So that just shows the impact that this has. Who are the caregivers? Well, 2/3 of dementia caregivers are women. 30% of the caregivers are over the age of 65. Over half of the caregivers are providing care to their parents or their in-laws, and about 10% are providing care to their spouse. Again, I just wanted to give you this overall picture of the numbers of caregivers that are out there. I wanted to read this because I really thought that this spoke to generally to the heart of a caregiver. And it says, I will. When you forget, I will remember for both of us. When you get lost, I will find you. When you are sad, I will be sad with you. When the fear comes, I will comfort you. When you cry, I will dry your tears. When you lash out at me, I will not be angry. When you repeat, I will have patience. When you forget my name, I will understand. When you cannot eat, I will feed you. When your legs fail, I will carry you. When you long for home, I will be your safe place. When your journey is ending, I will be by your side. I will love you for eternity. I will. And I just felt like a lot of caregivers, whether they verbalize this or not, have this placed in their heart and in their mind. So what are the top reasons that people become caregivers? Through the literature that I researched on, the first one is they want to keep the family member at home. That is the number one answer we hear. I want to keep my loved one at home. The second one is proximity. I'm the closest one to my loved one, so I am the one that's going to be responsible in providing care. And then number three is I feel this perceived obligation. It's my responsibility to provide care for the loved one, whether I'm an adult child, a spouse, or just a friend or loved one. I know this has a lot of words, but the main things I want to stand out to you are the things in yellow. And a lot of times when we think of caregivers, we think of what we call ADLs, activities of daily living, dressing, bathing, toileting. We think of those physical things that they do. But I have two slides here of the things that they do because I want to point out what caregivers do. It's so much more than just the physical care. So they also provide what's called IADLs, instrumental activities of daily living, meals, transportation, medications, managing finances. Again, the point of these two slides is to show caregivers do so much. Another one is they're helping the person with dementia adhere to all of their treatment obligations, not just the dementia. And that's something I think that family and friends forget about, that there's so much more. And then managing behavioral symptoms. Unfortunately, sometimes the person with Alzheimer's or dementia can have personality changes. So they're having to manage, that's an additional task that they're having to manage as well. Caregivers also have to find support. They have to find support groups. They have to find, if they want adult day service programs, not only do they find them, they arrange for them. And then they have to supervise if people are coming into their home or if they're going to a facility. And then this next one's a tough one. I always say as a therapist, this is what keeps therapists in business as family, because you have all of these family dynamics, and those are magnified when it comes to your aging parent, especially if they have Alzheimer's or dementia. So they are having to maneuver and manage through all of that as well. And they're also providing emotional support and this sense of security to the person with dementia. So you can see when people ask you, what do you do as a caregiver? Make sure that you are giving them the full spectrum of what all you are doing. So after I've presented that, who's the hidden patient? The hidden patient is the unpaid caregiver. A lot of times, and I learned about this term, oh my gosh, like 20 something years ago, and it really stuck with me because it was talking about how as the caregiver, they lose themselves because they are focused on the person they're caring for. Again, more numbers because I want you to understand the impact. So the unpaid caregiver, the hidden patient, 30 to 40% of dementia caregivers have depression. 44% of dementia caregivers have anxiety. And the thing with those numbers, as a mental health professional, I truly believe those numbers are low. I believe because of stigma and people don't want to admit it and they don't want to get help, those numbers are more than likely higher. I also know that the #1 mental health in America for adults is anxiety. So I have no doubt that the number is probably higher. And then also caregivers, the hidden patient, they indicate that they start to have this decline in their social network. That probably sounds familiar to many of you as well. And so here again, I just want you to look at the things in green. What they're talking about is the hidden patient, the caregiver, the one doing all of these things that we listed. A lot of times, almost half, you see 41% are saying they're doing this alone. No one's helping them. No one's offering to help them. We also know that dementia caregivers are 1.5 times more likely to indicate substantial physical difficulty. Again, if you're thinking about all of those activities of daily living, transferring, bathing, dressing, all of those things. Also, the dementia caregivers report that their quality of sleep goes down and that they reportedly lose on average 2.4 to 3.5 hours of sleep a week. We know sleep affects everything. Sleep affects our mental health. It affects our physical health as well. And then this one is what I really want to focus on down here at the bottom is 27% of dementia caregivers are saying, hey, I'm pretty much neglecting my own health. Again, I think that number is probably higher, but this is what people that have admitted to are talking about. So the main thing I wanted to understand is why. Why are caregivers not taking care of their own needs? Through clients that I've worked with, through the research, through the literature, and also on a side note, my father is in the middle stages of dementia, and actually my parents moved in with my husband and I about a year ago. So it's kind of interesting going from the book smart to the actually walking through this journey with them. And I mean, everything I talk about in here, it's like I'm seeing this with my parents. And so the top 2 reasons that caregivers they're becoming the hidden patient and not asking for help. One of them is caregiver guilt and just the trouble with asking for help. And I imagine some of you will see yourself in some of this information. So I want to talk about caregiver guilt. We have this myth that if you don't provide full-time hands-on care, you're just not doing a good job as a caregiver. And this is this myth that we pretty much put on ourselves a lot of the time, feeling that we have to do it all of the time. Again, I've listed some of the many roles that the caregivers are having to take as a caregiver here. The second myth is you should be able to do everything by yourself and you shouldn't need help from anyone. For some reason, people think that, oh, they've got a caregiver, they're fine, I don't need to offer help. But the main things I want to point out to you are, you know this, but sometimes you don't know this. Caregiving requires a team. No one person can do it 24/7 every day successfully. And so you can see a list here. It can be family, friends, neighbors, hired help. That's why we have the professionals out there. That's why we have the professionals working in shifts. And so another one is caregivers are trying to do everything completely on their own, and this is causing chronic stress. And so this can lead to burnout and also serious illnesses, again, alluding to the hidden patient. I was looking at some articles and there was an expert talking about how do we reduce caregiver guilt? What do we actually do? And I loved this first one because it's realistic. It says, don't aim for guilt-free caregiving. I mean, to tell someone don't feel guilty doesn't do anything. And so I think understanding it and saying that there's always a difference between what we are truly able to do what we think we can and what we should be doing. And I think to really think about that, to stop when we have those thoughts of, I should be doing this. As a therapist, that when you say the shoulds all the time, that's called a thinking error, because we have these ingrained thoughts in our minds of these shoulds. Well, who said we should be doing this all of the time? And so that's number one. Another thing we can do to reduce caregiver guilt is giving up the fantasy of rescuing others, kind of making that deal with God, or just making that deal with whomever of, if I work extra hard, if I do this and this, somehow they really won't have dementia or Alzheimer's. And so we need to keep our goals realistic, and we have to consider the reality of our loved one. Other things we can do to reduce caregiver guilt is we need to maintain balance. Again, I think we know this intellectually, but really just accepting it emotionally and actually following through with it. And we need to take care of our emotional health. And so being a caregiver takes up most of our time and our energy, but you need people. We are social creatures. Even people that are introverts still need people. Need to not let all of our social outlets pieces because of our responsibilities. This next one I found very interesting when I was reading this article. We need to tolerate ambivalence. And what it was talking about was, why do you think because now that they have Alzheimer's that you shouldn't get mad or irritated or frustrated with them? Didn't that happen before they had Alzheimer's and dementia? And that one really stuck out to me, is that we're human and people will get on our nerves and we will get frustrated. I mean, even me, I get frustrated. It's so funny. I'll get kind of short or something, and my mom will look at me and go, Natalee, your dad has Alzheimer's. I'm like, I know, but to me, he's my dad. He's not a person with Alzheimer's. And so sometimes when I get short or irritated, my husband will say, aren't you a therapist? So I say, not at home. But anyway, so really just remembering that we're human, and then finding our motivations. What motivates us? And sometimes in mental health, we call it reframing. It's that glass half empty or that glass half full. So instead of saying, I have to do this, we can say, maybe I enjoy helping others, because we know research says that when we volunteer and we help others and we take that focus off of ourselves and we help others, it actually helps us too and helps our mood. So just finding what can motivate us in a positive way. Asking for help. I talk about this one in almost every presentation. Why? Why is it hard asking for and accepting help? Some people have a fear of rejection. I do not. My parents brought me up to say, you don't know unless you ask. All they can say is no. But some people have a fear of rejection. The second one I hear all the time, I don't want to bother them. They have their own lives. My mom even does that about my other sisters. And so I have to educate her and say, yes, but you're mama and he's our dad. Some people are embarrassed. Their fear of being judged. They don't want others to know that they have a loved one with Alzheimer's or dementia, and that goes back to stigma and all of that. Or if they come into their home and it's not as clean as it needs to be, or their fear they're going to be judged at how they're caring for someone. This other one is the myth. No one can care like you do. Okay, maybe, but they still can care. They still can give maybe I don't care as well as my mother does, but I can still help. And I always have to remind my mom, go do stuff with your friends, go do this and that. I'm here, I can help. And then there's guilt from the person with dementia or the person with Alzheimer's. Don't leave me, don't go. And so you have to really work through that guilt. And then this last one you see a lot is that loss of identity. I don't know who I am if I'm not caregiving. And again, that goes back to you've started isolating yourselves, you're not socializing, you're so focused on being a caregiver, you don't know who you are. So when asking for help, we need to, first of all, be realistic. Caregiving is demanding. Asking for help does not make you inadequate or make you weak. We can all ask for help. The second one is make a list. I love this. Carry a little notebook in your purse, in your car. of your list of what you need. If you're like me, I have to write down everything that I need to do, or I'm going to forget. So keep your to-do list with you at all times. So when someone asks you, you can pull it out. Love this third one. It had never occurred to me, and I always share this with family members. You need to find out abilities and interests. So when I'm staying with my dad, I am not going to give him a bath, right? I'm also not going to cook. I don't cook. But what I can do is I can play Uno with him. We can get in the car and go pick up food. We can watch TV together. We know what my abilities are and my limitations. So think about that when you're asking for help. I have another sister that loves to cook, so she brings over meals. I have another sister that comes down and likes to watch sports with my dad, not me. But so they do that. And so really just finding when you're asking for help, always have your list and know the abilities of the person you're asking so that you're not set up for failure. Plan ahead. That's funny. When we have people with Alzheimer's, we can try to plan, but we know that doesn't always happen. And then to be clear, and don't downplay it. Don't say, oh, it's only a thought. It's no big deal. It is a big deal. You do need help. So have that list, have it ready, match the abilities, and don't downplay it. Love this too. I was reading an article and it was talking about preparing for visitors. So you've finally admitted you need help. You've got your list of who can do what needs to be done. Now you need to prepare your visitors. And so if these people haven't been around, if someone with Alzheimer's or dementia, or they haven't been around your loved one in a while, the article that I read, and you again can have the link to it, it gave you a template for a letter. So you can write a letter, or you can write an email, or have a phone call, have a Zoom, whatever. Communicate with your family, your loved ones, your neighbors, your helpers, so they're not shocked, so they're not scared, so they're not feeling inadequate. So tell them, hey, they've lost a lot of weight. Now they are using a walker, or incontinence, so that they're not embarrassed, or that they don't embarrass the person with Alzheimer's. And so anyway, there's lots more, but you get the gist here of just giving them a basic understanding. So again, it can be successful. The consequences of not taking care of you is your mental health. And it also affects the person with dementia as well. So we talked about depression and anxiety earlier. And so a lot of times, if people aren't informed about depression, they think it's just crying. And there's so much more to depression. Depression can be when you have aches and pains, but there's no reason, you can't find a reason for it. You can be overeating or undereating, oversleeping, not sleeping at all. You can be tired all the time and no energy. Also, this is one that a lot of men have, but women have it too, is that anger or that irritability. You just become really short. That can be one of the symptoms of depression. Another big one is you're not finding pleasure in activities that have always brought you pleasure. That's a key one as well. Feeling excessive guilt, feeling worthless, hopeless, even thoughts of death or suicide. And I'm not saying it always has to be the extreme one. It can be, I would be okay if I went to sleep and didn't wake up. That's passive suicide ideology. And so those are really important. All of these are important, but if you're feeling hopeless, thoughts of suicide, feeling worthless, you definitely need to talk to your primary care physician. Many of them deal with depression and anxiety. Symptoms of anxiety: increased muscle aches or soreness, impaired concentration, you just can't concentrate. We see irritability, some restlessness, and excessive worry. The point is here, look, when you have anxiety or depression, a lot of those symptoms overlap. A lot of times they coexist together. And so these are just some of the common symptoms if you're experiencing these and you're experiencing them on a regular basis, that you really need to get help. And so again, making you the hidden patient. you must take care of you before you can take care of someone else. I know I always think about that, what they do on the airplane, right? You have to put the oxygen on you before you can help someone else and all of that. And so that's kind of what you think of, you should think of about Alzheimer's and dementia. And again, I think intellectually you know this, but emotionally you don't always follow through with that. So the first steps, acknowledge you cannot do this alone. And so I think that is the first step. And I'm so glad you're here today, whether you're an unpaid caregiver or you're a professional caregiver. This information is important for professionals as well to really understand what the caregiver is going through. So acknowledge that you cannot do this alone. Learn to make yourself a priority. And one of the things that wasn't listed on the depression is low self-esteem. And so if your self-esteem has gone really low, that can be one of the signs of depression as well. And to know that you are worth it and you are a priority. And again, you've got to take care of you. And you need to know your rights as a caregiver. I don't know if any of you know that there are published rights as a caregiver. I think there's 10 or 11. And I pulled out 4 of them that really touched on the topic we're talking about today. You have a right to be appreciated and to be emotionally supported for your decision to be a caregiver. You have a right for respite care. And respite care is that temporary relief, that short-term relief. Well, I worked at a local facility here in Waco that catered to Alzheimer's. And we had this spouse and she wanted to take care of her spouse at home. So she took care of him Monday through Thursday, and he would come to the facility Friday through Sunday. And I thought, what a wonderful idea to where she's still participating, but she's getting that respite. And then you have a right for that respite care so that you can take care of your own health. This next one is very important. You have a right to expect all family members to participate. And so that's real important to go back to that list and deciding whose abilities can help with what. Even if someone says, I don't know what to do, it makes me nervous. You know what you can do? Have them come over and spend time, and you can just go in the other room and take a nap. It doesn't always have to be this big, grand thing that you're going to do. But then we do that with my mom as well. I'll be like, hey, Mom, I'm in my office right here. My dad, he's a social butterfly, so he lives in our living room. I know, my husband is amazing. And so he lives in our living room. So I'll turn to my mom and say, go take a nap, go rest for 30 minutes or whatever you need. And then the next one is, this one can be a hard one. You have a right to care for your loved one as long as it's safe and it's feasible to keep them at home. And so you have that right to explore alternatives and not feel guilty about it as well. You need to know what's out there. And so there are a lot of caregiver supports and interventions. A lot of times you can get a case manager that can help you. They manage all of the different things that are out there. So there's Texas 211. You can call 211 from anywhere in Texas and get the area agency on aging, and you can get assistance. You can say, I have a loved one with Alzheimer's. I need to learn about respite services. I have a loved one with Alzheimer's. I need to apply for Medicaid. If you just call 211, they can get you in touch and give you the information. Other things are coming to things like today, the psychoeducation approaches, and these are different programs, different resources that are out there. I always tell everyone to go to alz.org, the Alzheimer's Association. I am not a technical guru, but I love their website. It's easy to maneuver through. You can just type at the top what you need, and it'll take you to it. And one of the things they have at alz.org is they have a tour of the brain. So you can go watch that and see what's happening when someone has Alzheimer's. And they just have lots of information. Another thing you can do is get counseling. As a therapist, I also do that on part-time on the side as well. I go into different assisted livings and I see people as they're transitioning from home into a facility. But I also see the adult children out in the community as they're coping with this as well. What I always tell the person that I'm counseling is, it's nice to not have a family member or the facility staff. It's nice to have someone, I'm going to be objective. So I don't have anything to gain by not telling you the truth and helping walk alongside you on this journey. And I know some area agency on aging, if you call some of them, they will have counselor services that they can get you in touch with as well. Respite, which I mentioned earlier, whatever respite means to you, someone coming in your home while you're there, all the way to you taking them to a facility. Other support services are support groups. They have Zoom ones, they have in-person ones. You can find them daytime, evening time, weekends. I think that, yes, you need to stay educated on this disease, but there's nothing like walking alongside someone who's going through what you're going through. And when you go to these support groups, you're sharing what's working, what's not working. And that's the thing. There's so many things you don't find in the textbooks that family members say, hey, this worked this time for me. Why don't you try this? And so we have that where, earlier I said a lot of times caregivers are isolated, but you go here, I'm not alone. They get me. I don't have to explain every little thing. So in summary, I wanted to review, that's the professor in me, wants to make sure you know everything we covered today. One is caregivers do more than others realize or recognize them doing. So make sure you're educating everyone on what all being a caregiver entails. Number two, caregivers cannot do this alone successfully. It can only last so long. Number three, let go of the myths about guilt and asking others for help. Number four, remember that you have rights. You have rights to ask others to help you. You have rights to not do this alone. The next one, you need to be able to recognize the symptoms of anxiety and depression that accompany caregiving. You need to understand the consequences of not asking for help. And that means you're becoming the hidden patient. Excuse me. You need to use the supports and the interventions that are out there, and you need to make yourself a priority. This last thing is a quick plug. If you want to follow what I'm doing, if you want to follow, I always say I'm a supplement to the Alzheimer's Association website, but I'll post stuff about mental health. I'll post stuff about caregiving, seminars, things like today. And so if you're interested in following, or here's my email. You can email me as well if you have any questions or anything to follow up. Thank you. And then I also have the resources. You can take a screenshot or we can email that to you as well. And then lastly, I do have, there were 10. Okay, so you have the caregiver rights, there were 10. So at this moment, I will open it up to any questions or comments. Anything really stand out to you? Any questions? I get so worried that I'm going to go past the time. So if I talk too fast, I'm so sorry. I was looking, it's only 1:37. We got plenty of time.
Yeah, we have time. There were a couple of things in the chat box that I wanted to bring up in case you wanted to comment on them.
Sure.
One was from Terry, and she said some people don't ask for help because they're afraid to bring strangers into their personal situation. And I can kind of relate to that because some of us were told, what family business is a family business, and we don't want to, So maybe you can talk about that a little bit.
Oh, sure. Well, first of all, I was brought up that way too about, I think there was a show my mom liked called Keeping Up Appearances. And yes, that we don't share those kinds of things with our family. I was also brought up with, and I had a great childhood and great parents, but none of us are perfect. And so we never talked about mental health. So really you just have to come into find your comfort zone, because the thing is you also can go by word of mouth. You can also do research on them. They have a registry for like CNAs that if they've ever had anything against them, social workers too. And so, but I think what I would do is get in touch with your local Alzheimer's Association, they have the relationships out in the community. For instance, Christine here in the Waco area, she has the relationships out there. She knows some companies she can suggest. She also knows some individuals that she has been, that she knows that she can give to you as well. But I know if you go to the organizations and the companies, those staff employees are bonded. And so, but I am a true believer in going with your gut feeling as well. And so I would have no problem if I hired a service and a caregiver and I didn't feel comfortable with them, of calling them and saying, you have that right. That's the thing about being a caregiver. You have that right to say, hey, they didn't click with my loved one, or I wasn't comfortable with them. Can we try someone else? And so, but you're building relationships. And so it's going to take time. But those are, if you don't want them in your home, then maybe if you have, like I said, the adult, I hate the word daycare, but adult day services in your community. Or I know in Waco, we have, there's one support group where the people that they can bring the person that has Alzheimer's, and they do activities while the people meet with their support. We need more of those. But so those are things I would do, is word of mouth, go with your gut. Professionals are bonded, or find some different activities you can take them with where you're getting the respite, but it's not in your home.
Yeah, I think your networking idea is a really good one. I know my mother lived in a different city from me, but she had terminal cancer, and it was through that networking and that word of mouth we found people to stay with her when she was near the end of her life, and it worked out beautifully. Let's see. Betty also mentioned that people have a lot of trouble sometimes reaching out to their family for help. And I always say, well, if you had a dysfunctional, and I'm using that term very broadly, if you had a family with issues before this disease entered your life, then it's not going to go away magically. So maybe you can talk to that a little bit.
Sure. Well, I think it's a really good idea to have a professional in on this. And so, again, I'm not saying that Alzheimer's Association has every answer, but they just have so many contacts. And so what I would do is talk to your family or talk to a professional and say, how do we break this news? How do we do this with people we're not close with? And really what you're doing when someone gets diagnosed with Alzheimer's or dementia is you're getting that care team together. Because unfortunately, not all family members are going to help. And so, and then also you have some people that talk and they have good intentions, but then they don't follow through and do it. So you really need to figure out who's going to be the core of your care team. Then you can bring in a therapist. You can bring in an Alzheimer's volunteer or advocate to really get that discussion going and to keep it where it's not just attacking. And so that's why I think you really need to have a professional, someone who has facilitated group therapy. And so that we know how to get it back focused. And so, and it's also interesting that sometimes people will listen to the professional and not the family. Yeah. So, right. Because, it just like in my family, it's like, I don't know, it doesn't matter how many letters behind my name, I'm the baby. So they're like, you're just Natalee, we're not going to listen to you. So sometimes if you just bring that outsider in to help facilitate that. And I think one of the main, how we have Al-Anon for alcoholics, I think we really need family members to learn. They need to know about the disease and not just what they see on social media. So giving them that basic information. Here's what the disease is. Here's what we can expect. And then again, how can we get whose strengths, who can do this and who can do that? And, one of the things I learned, my family knows I share all our stuff because, I'm walking through it. But my dad, when he had COVID and was in the hospital for, I think it was 2 months, and we had to have that structure because only certain people could visit and all of that. Boy, it worked out so well because you knew you had a responsibility. You knew you only had a certain time slot, and you knew what the expectations were. Versus if they're just living with you at home, people will say, yeah, I'll come by and do this and all that. So I think really having that structure might help some families as well. Did you have anything else, Glenda, to add to that?
people, I don't know that people take a real advantage of this, but I know there's care calendars out there. And when we're
Mhm.
talking about scheduling, I think that's a beautiful tool that people can use. And I'm just not familiar enough to know of how many caregivers are really using that tool. I think it's a good one to try.
Definitely, definitely. I think so too. Just having your calendar. I think, like I said, that accountability. And then also
Yeah.
just knowing, I mean, we're humans. We, even like today, we had how many sign up? But if we don't have that, like that accountability, life happens.
Yeah.
And so I think just having that schedule, that scheduled time, and even, like I'll tell family members and friends, it doesn't have to be this huge chunk. Come
No.
by and see him for 30 minutes and interact, during your work day, take your lunch, or if you happen to be in this area. And so I think we have these certain rules in our mind of what it has to be to help. And so if we can just help break it down to
Yeah.
15 minutes, is amazing what it can do to interact with him.
Absolutely, absolutely. Sandy brought up another issue that I think is an important one. She talked about why caregivers sometimes have trouble taking care of themselves first is the huge financial burden that many face. And she talked about the cost of caregivers and also respite care is so expensive. Can you kind of address that a little bit?
Yes. Well, I know that I am not going to say I'm the expert on financials because I'm not. I know there are certain elder attorney lawyers that are, but I also know you can talk to the Alzheimer's Association, not the Alzheimer's, sorry, the Area Agency on Aging, and they have some respite services for free. And
Yes.
so that's why you really need to, we were talking earlier about knowing your community and getting your contacts out there, because they will have, they have some services where they'll provide respite where they come into the home. They also have services where if you need a ramp built, they can help with that, or if you need grab bars. It's just people just don't know about it. So I think getting to know your local area agency on aging and finding out, just being blunt with them, what services can I get?
Yeah.
And get with them and find out that that can be a start. If you're a veteran, they can lead you to, okay, there's certain services out there for veterans that can come in the home. And so those would be my starting points with that would be elder law attorneys, the area agency on aging, and then just Googling, VA benefits for respite services. That could at least get you started. But
Right.
it is expensive. It definitely is.
Yeah, and so many caregivers have to quit their jobs oftentimes to, be a caregiver. I
Mhm.
just can't imagine. They never can catch up on that again. Is what the statistics prove to us.
Yeah.
There were a couple of people, Natalie, that wanted to know if you will provide your slide presentation. I told them you're providing your resources. I didn't know whether you wanted to provide that slideshow or not.
Sure. Here's my thing about that. Yes, I love providing to the caregivers. I will share anything I have. The only thing I ask is that you don't take this and use it in another presentation as your own.
Yeah, yeah,
Because there's been
exactly.
time, sweat, and tears put into it. But I'm pulling stuff from everything too. But and just always to give credit if you're using some of this stuff for others, to use those resources. But yes, that was a lot of information, and I will gladly do that. Just if you just don't reproduce it, of course, share it with family members and all of that as well. Yes.
Well, and you can always go back and look at it as a podcast on our Caregiver Teleconnection website, and you can actually do screenshots, and you can either do it by using your computer, or I have done this, and I will admit it here. We'll take my phone out and take a picture of a certain screen that I missed some information on, and so that's also available to you. Natalie also mentioned Texas 211. That is a national information referral service that you should be able to use in your local area just by dialing 211. It's an information referral service. The other one I want to give you, since Natalie brought this up, is the Elder Care Locator. And this is a national service that is available to you. And so their toll free number is 800 677 1116, or you can go online if you're all of you have a computer because you're on with us on Zoom, and their website is www.lcare.org. elder care, all one word, eldercare.acl.gov for gov. And so that's a wonderful service also. You can look up things by your area code on that particular website. Well, we still have
one quick thing. I'm sorry to interrupt.
Yeah.
I wanted to teach. Okay, so I told you I'm a professor and I do teach online, but I know just enough. Sometimes I log all my students out of Zoom and they get out of class free and they, don't tell me how to fix it. But one day I had this group of students and it was just it was my first time teaching this one particular class. And I said, I want to take a picture of y'all. I want to remember this moment. So I pulled out my phone and took a picture and they all laughed at me and they said, Dr. Oliver, do you know if you hit, like you were talking about the screenshots? I didn't know this. In 2022, I didn't know. You hit Shift, the S, and then that button on your phone with the 4 little squares. On your computer.
Yeah.
You see it's the 4 little squares, Shift and S. If you hit that, up at the top, you'll have a chance where you can do like a rectangular where you drag what you want to. Or if you go to the top right, you'll see where it'll take a screenshot of the whole screen. So in case anyone didn't want to ask, I wanted to put that out there because it has been amazing. I do it all the time now.
I know when I miss something on one of these presentations and the presenter will say, okay, well, we're going to tell you this later. I'm going, oh my gosh, I don't have that. And I'll just take my phone out and take a quick picture of it. Well, we have about 10 more minutes. Does anybody have a question, a comment, a situation that maybe you're dealing with and you're feeling about the hidden patient that you would like to bring up with Natalee? I know she'd love to hear from you and address what questions you have. Okay, Sherry.
I have one. I've been caring for my mother in my home for a little over 3.5 years, and she's got advanced Alzheimer. She's in like stage 6, so it's getting very difficult. And I have recently, I've come to terms with shedding the guilt of needing to redirect her. I rather than trying to solve her struggle or get her to rehear something that she has forgotten or that I've explained, and if she's agitated or the sundowning syndrome is also an ongoing issue. In the beginning, I felt guilty, like I was going to redirect her into something else or temporarily say, yeah, okay, well, we can work on that, or we can look into that, knowing in 20 minutes she's going to completely forget. I used to have guilt with that, and now I'm like, hey, if I can keep her calm and diffuse and redirect, it's not my fault that she's going to forget. But there was some guilt associated with that.
Well, first of all, I love how you spell your first name, Sherry. It's pretty cool. Second of all, thank you for sharing. And there is guilt. That's why I love that one article. It says guilt's not going to go away. We just need to learn to manage it. And so one of the things along with redirecting is a thing we could do a whole training on is validation therapy. And so what that means is we're meeting them where they are. And so sometimes we may call it a therapeutic lie. So instead of, that reality, and if redirection's not working, it's just validating their feelings and validating where they are. And sometimes that can help with the guilt as well. It's not tricking. It's not anything. It's you believe that you're trying to go home or talk to your mom or whatever the patient is feeling. And so I just wanted to throw that out there. Additional, if you can Google validation therapy and learn about it, it's just meeting them where they are, affirming their feelings, not arguing with them, like you said, not trying to bring them back to reality. But it's not we're making them happy. And so that's kind of how I look at it, is we're programmed a lot of times to where we're supposed to be reality, but reality, we have to think what's the best thing for the person. And so, that if that redirection is a good thing, or just validating how they're feeling is a good thing. But I'm glad you worked through your guilt, and it is a process.
It's a struggle of like, I'm her daughter, I'm her POA, I'm her caregiver, I'm one of her few remaining friends, and for the majority, her whole social network. So that's a lot to deal with at the end of a work day. And I kind of have to just remind myself of the juggle of my priority is her safety and her physical health. And sometimes to be a good caregiver, I can't be a good friend.
Right.
So
right. And it
you
doesn't
have
mean
to
you're a
kind of
bad daughter.
Right. You have to prioritize, like, okay, for the next hour, I'm going to be her friend and we're going to work a puzzle. We're going to sit on a patio. But then come dinner time, now I have to be caregiver and I have to make sure she eats, whether she thinks she's hungry or not, because that's starting to be
That
affected. Like,
nutrition.
she just doesn't remember to be hungry. She just won't eat.
Right.
So I just put it in front of her, but not everybody can do what we do.
No. And what I'm hearing you say is you're doing a whole lot. And so if there's anyone else that can come in and even just sit to help encourage eat with her, or just, and you don't have to introduce them as this is a caregiver, because then they might say, I don't want a stranger coming to my home. So what you can say is, this is my friend from work. This is my friend from church. They're going to come eat with us. And so to where they start getting that, and then y'all start playing a game together, or y'all do whatever they like to do. That's another way to kind of break that ice and get them in the home to where eventually they're sitting there eating with them, and maybe you can slip away, even if it's just 10 minutes.
Yep.
Thank you. Thank you for sharing.
Thank you, Sherry. That was great.
Yep.
I could really relate to that. And on your validation therapy comment also, Natalee, I know when it came to me, that it was so important to do that was someone was on one of the sessions actually was talking about how many times do you want to remind somebody that their loved one has died? Dad, that's not right. They died 5 years ago. And you say that day after day after day. And what reminded me, Natalee, is when you said you're making them happy. If you're not bringing that up and you are where they are, you're making them happy. And what more could you ask for?
Right. We don't want them to have to grieve through that or go through that all the time. Or no, Dad, your mom is dead. I mean, we don't need to say that. Instead, we can say she'll be here later. She's at the doctor or whatever. It's just meeting them where they are. And I think one of the hardest concepts, which all of us struggle with, is that remembering that it's not about me. It's about the outcome. We need to think of the outcome. Yes, our feelings are important. I'm not saying they're not. I'm not saying the opposite of what we're talking about today. Right. But what I'm saying is what is that outcome? What is my outcome and my goal that I'm trying to get? And so we don't always have to have that reality and that blunt and that honesty like that. If the outcome is there's just going to upset them.
Yeah. Absolutely. So that really brought that back to me. And if you think about it in those terms, how would you feel if somebody was reminding you every day? In my case, I'm a widow, that my husband died and blah, blah, it's just not the way to go. So validation therapy makes total sense when you're dealing with somebody with dementia. Well, we have about 4 minutes left. I know that surprises you, Natalee.
It does. I worry so much about going over.
Exactly. So let me tell you a little bit about what's coming up on the Caregiver Teleconnection before we log off, and I have a couple other things. I was telling Natalee early on, I looked at our September calendar for the Caregiver Teleconnection. We have 11 sessions coming up in the month of September, which begins on Thursday, by the by. I'll be back with you on Thursday with Dr. Cam Cummings, one of our Texas specialists in dementia. And this is a new topic to me. And I told her before I get on this, I've got to do some reading myself. It's about talking to children about dementia. And what a difficult subject that is to talk with younger people about. So I'm thinking that is going to be a really interesting one. And that's Thursday, September the 1st at 1 o'clock Central Time again. And following that, on Tuesday, September the 6th, I'll be back with you again. It's going to be a busy month for me. 11 o'clock Central Time, and we're going to talk about isolation, the curse for caregivers. And it is indeed, you touched on that on one of your slides. When we're caring for someone with any disease, but particularly dementia, that support and those care friends that we have, it just diminishes over time because they feel uncomfortable. They don't know what to say. They don't know what to do. So I encourage you to look at the Caregiver Teleconnection calendar coming up. You can call our customer service representative, and she will be happy to get that calendar to you. Let's see over here. We have another comment. I work in hospice and bereavement. This is from Noreen. I was also a caregiver for my father for 14 years before he recently died. Our condolences to you. He had dementia and even worked in the field. Oh gosh, it was often frustrating. A local day activity center asked our company if we could provide a session for caregivers on caregiver guilt and anger. And this has been a great resource. So that's wonderful.
Thank you.
Wonderful, wonderful. And thank you for all of your kind comments. You will, if you register for the call today, you will receive a follow-up email. And in that follow-up email, we will provide the resources that we have here from Natalee, including the slideshow presentation. Please remember and abide by what Natalee has said. Don't go sharing that and use it as your presentation. The resources are there to help you. That's what we're here for. So you can look for that. We will also ask you to give us feedback on how you think the presentation went. If you have other presenters, if you have other topics you'd like us to present on, let us know that also in that email. So final comments, Natalee. We have 1 minute left. Yay.
Take care of yourself. It's not selfish. Quit being stubborn. That's what I tell my mom. So because it took me many, many times to sit down with her, and finally she went out with some friends and she came back. I mean, this took a couple months of them living with us, and she came back and said, "Thank you for making me do that." And so quit being stubborn, and help is a good thing. That's what I would say.
If I had $1 for every time my parents tell me, "Don't be such a hardhead," I would be a wealthy woman at this point in time. I want to thank each and every one of you for joining us today. I know Natalee will support me in this. We certainly enjoyed having you with us and taking time out of your busy day.
Yes.
So please join us again in the future. Natalee, thank you so much for your presentation. It was wonderful.
Thank you.
And I hope to see you and hear you in future sessions.
Thank
Bye-bye.
you. Bye, y'all. Thank you.